I had been steadily putting on weight a little at a time. 5 pounds here, 15 pounds there, take off a few, put on a few more for probably about 20 years. And I got on the scale at 265 pounds and was horrified. I'm about 5'4". And my primary care doctor told me I was headed fast and furiously towards diabetes. I had high blood pressure, I had high cholesterol, I had horrible acid reflux, and she suggested that I needed to think about doing something serious. We had gone to Hawaii about 1995. My husband got a trip to Hawaii through his company. And it was January, and I didn't know where the bathing suits were, and I really didn't care where they were. We were going to Hawaii. I was going to buy a bathing suit in Hawaii. How exciting. And we stayed in this really lovely 5-star hotel. It was great. The gift shop went as far as size 16, and I think I was probably a 20 or 22 then. I wasn't at my heaviest. And I couldn't buy a bathing suit in Hawaii, and I was angry. I was hurt, I was embarrassed, and I didn't say much, and of course I found an excuse not to go to the beach, or just to walk on the sand, in my street clothes, and it angered me because men have it so easy when it comes to buying bathing suits. They know what their waist size is, and most stores carry a larger size selection than they do for women. And the lady in the store was very nice, but she couldn't help me. There was nothing she could do. And that started me being annoyed with my weight. Up until then, I don't think I thought my weight defined who I was, but then it did. I went to 3 or 4 different doctors in the area who had seminars. You could go and hear about the surgery and talk to them and ask questions. And I went to Dr. Washington's seminar and actually sat in the audience next to someone who had had the surgery a few months earlier. And she was so positive and so happy with what she had done. I couldn't believe her before and after pictures. I came out of the seminar pretty positive about it, came home and talked with my husband about it. And then went back to my primary and said that I thought I was ready for surgery. We talked about the options, the kinds of surgery, and I knew that I would not be good with the lap band. That required a little more willpower and a little more dedication than I thought I had at the time. So I made the appointment and went back to see Dr. Washington and met his staff and got the list of all the things my insurance company required, and then sat for another 3 months and thought some more about it. Talked to people that had had the surgery. I was lucky enough that somebody I worked with had had the surgery a year before, and I saw her journey. And the diabetes really scared me. My father died at a young age of heart disease. We had had a neighbor who had diabetes, and she lost her sight, and there was just so much going on, and I had young children, and I wanted to see them grow up and get married and have adult lives. So I made the decision. Coming into Dr. Washington's office, I was a little embarrassed. I mean, everybody, you see a fat person going into a gastric bypass surgeon's office, you know what they're there for. Nobody on the staff, nobody in the office ever made me feel like a fat person. They had hospital gowns that actually, in the office, that actually fit me. I'd had breast lumpectomy where the gown didn't fit me, and I had to wear 2 of them. This was really nice to know that everything was done to not make me feel bad or feel embarrassed. So I went back to Dr. Washington and made the appointment and met Emily, and was luckily to be assigned to Emily as my guide through this journey, and started the journey. Saw a dietitian for about 6 hours of consultations. I went to a psychiatric evaluation, which was a little scary because I kept thinking, what are they going to find out about me? Went to a lung specialist and had my heart examined to make sure that I was healthy enough for the surgery. And then continued to see my primary care doctor, and every month we worked on a different aspect of the pending surgery. Taking little bites, sipping water, putting down the fork in between the bites, all the things I needed to do when the surgery happened. And then 3 weeks before the surgery, Dr. Washington had my husband come in with me, sat down and explained everything to us, scheduled my endoscopy. They go down and examine to make sure that everything is where it's supposed to be when they get in there to do the surgery. And made my husband sign an agreement that he would support me, which I thought was really, really a good idea, because he wound up being very supportive. And then I went to the hospital and had the endoscopic evaluation. And then the 2 weeks before the surgery, you have to go on a liquid diet because you have to lose some weight. The policy then was 15 pounds. I don't know if that's still accurate, so that your liver shrinks enough that it's not in the way when they do surgery. So I did that. Had my last Big Mac. Actually, I had a Burger King Whopper, and then went on the liquid fast and got really nervous and excited and read every article I could get my hands on those 2 weeks, and went online to a couple of different support groups to see what people had to say about pre-surgery, talked to everybody I knew, and got up the morning of August 12th, 2009, and got in the car and went to the hospital. August 12th, 2009, so it's just about a year and a half, and I lost 103 pounds. Yeah, went from a 28 to a 12. That's a big change. And it's funny, you drop it so quickly in the beginning. I had my surgery in August, and so there were some things that I had bought in size 18s and 20s that I thought maybe next summer I'll be able to wear, and when I pulled them out in the next summer to wear them, they were huge on me, and I never did get to wear them. But it was a fun experience. It really was. I had some upper GI bleeding, upper gastric bleeding. We don't know where it came from. It resolved itself. But I called him at 3 in the morning, and he called me right back and said, come to the emergency room, and I did, and he met me there. When he says call him anytime, he truly means it, and he calls you right back. Never put off, wait a couple of days, or there's no opening in the office, come in tomorrow or the next day. It's come in immediately. If you have a question, call him. I found that he was very consistent with his follow-up and with his care. He did every step of the surgery himself. He did the endoscopy before it. He did the surgery. When I came in with the bleed, he did the endoscopy to see where the bleed was coming from. He did every step himself. He didn't push me off to somebody else, to somebody who was covering, or and I felt as though he actually knew who I was. I wasn't just patient number 76 or patient number 204, that he actually knew who I was. It was the best health decision I ever made. I don't have any cholesterol problems. I don't have any heart problems. I don't have any acid reflux. I am nowhere near being concerned about diabetes at all. I can tie my own shoelaces. I can cross my legs. I'm so proud of that fact. I can cross my legs. I can walk the 2 miles in my development and I'm not winded. It's just such a difference. It's marvelous because I can do things with my daughter and my future daughter-in-law. We can go shopping together because I can walk into any store and I'm not, waiting for them to look because there's nothing here for me. I can keep up with them. We can go to the beach. We can, do things together. I'm not out of breath and huffing and puffing to keep up, and it's been a great benefit. It's just been marvelous. And they're all excited too. They enjoy seeing me do things that I never did before. Because you should normally consume about 80 grams of protein a day, and there's about 7 grams of protein in an ounce of meat or fish, you can't eat that much food anymore. I just can't eat that much food. So I do drink a protein supplement, and I do take a lot of vitamins because your body processes the food differently with gastric bypass, not so much with other kinds of surgeries, with the lap band, but with the gastric bypass. So you have to be mindful of what you eat. You have to eat your protein first. The other stuff is just kind of like window dressing. So a few bites of salad, not a big bowl of salad. That was hard. Portion control, like how much is a serving, isn't so important the first couple of weeks after surgery because your stomach just can't hold it. But as you get further out and chewing things thoroughly, we all kind of gulp and take a big bite and chew and swallow real fast. You have to really chew the things up, because if you don't chew up the food as well as you can, there isn't all that stomach acid anymore to dissolve it for you. You've lost that ability. So you have to really do the work that your stomach would have done before. But other than the learning to let go of that fork, and every weight loss program tells you that. Weight Watchers, Nutrisystem, they all tell you, put that fork down and let go of it. Before the surgery, that's what you practice, but it's really hard. After the surgery, it's not hard, because 2 or 3 bites and you're pretty much done for the first couple of months. You're amazed at how little you actually need to eat to function. The first time I had shrimp after surgery was about 5 weeks afterwards, and 1 jumbo shrimp, and I was done. That was it. I couldn't eat another bite. You learn to compensate. You order an appetizer as your main course. I do that a lot in restaurants. I'll say to them, I'll have a cup of soup for my appetizer, and I'll have the crab cake appetizer for my main course. And most restaurants are pretty accommodating. Food isn't that important anymore. Yeah, I still have cravings. Yeah, I still like a handful of M&Ms, but sometimes 1 or 2 is fine, and I can actually say I've had enough and walk away. I can actually leave food on the plate, even when it's cheesecake. A forkful is fine, and that would never have happened before the surgery. There was no way that I could. I might have walked away from chocolate cake when the house was full of people, but the minute the house was empty, I was in there eating the rest of it. I can walk away from things now. It's not that important. We went to the theater, and I could fit in the theater seats. There was plenty of room. I wasn't worried about, was I going to be able to fit? And someone who's never had that problem can't really understand how embarrassing it is to not be able to fit in a seat, to not be able to get around a piece of furniture in a restaurant. I still have a tendency to take the wider route, or be concerned that I'm not going to be able to squeeze behind something or around something to get to a restroom, but I'm getting better about that. But you don't realize how embarrassing it can be. And it may not be for the other people who are not the heavy person, but for the heavy person, it's embarrassing. It's great knowing that I have the energy to do things, that I'm not so worried about my health, worried about, am I going to be diabetic? Am I going to be bedridden? Is something going to happen? That's been a big, big weight off my shoulders. And I have more energy to do things and want to go places and do things, because I don't look any different than everybody else.